At Des Moines University Clinic, you'll find healthcare professionals with only one priority: you, the patient. Come see us for the very best in family medicine, physical therapy, podiatric medicine, and osteopathic manual medicine. Call today to schedule an appointment.
Hello, my name is Cameron Taylor. I am the president of the Student American Academy of Osteopathy. Thank you for joining us today for our osteopathic self-treatment to promote health in the body's ability to fight COVID-19. So first we wanted to talk a little bit about what is a doctor of osteopathy. We are fully licensed physicians, just like MDs. We do 4 years of medical school and we do a residency. We utilize all scientifically accepted methods of diagnosis and treatments, which includes drugs and medications, but there's a lot more to being a DO. In addition, we receive an additional training in what the osteopathic profession believes to be the most significant factor in comprehensive healthcare. We recognize that the musculoskeletal system, bones, muscles, and joints, is interdependent. A disturbance in one can affect the other functions in the body. So DOs use structural diagnosis, manipulative therapy of the musculoskeletal system along with traditional forms of medicine. We do this by diagnosing people with our hands. So a DO is not just something else, but we're something more. Just for the preface, I wanted to let you know that you could pause the video and follow the link to the handout. The handout follows the demonstration. So osteopathic manipulative treatment, also known as OMT, has been shown in numerous studies to support the body's own healing mechanisms, including beneficial effects on respiratory infections. Based on well-established osteopathic principles, this OST aims to promote the optimal breathing and circulation to support the function of the immune and nervous systems, while helping to reduce stress and maintain balance in the body. This OST provides exercises designed to remove obstacles to the body's own functions and therefore promote health. It is useful to use for those at risk of infection or those who are already tested positive for COVID-19. There is utility in these approaches for patients that must self-isolate and socially distance, such as during the 2020 COVID-19 pandemic. These treatments are going to be done by you. However, OMT is done by a physician. The following video was performed by Dr. Figueroa and Dr. Lewis and Ryan McDunn, a fourth-year fellow. Without further ado, here is our video.
Welcome. I'm Dr. Drew Lewis, an Associate Professor in the OMM Department at Des Moines University. We are pleased to share with you today a set of exercises to help promote health and help the body fight off infections like COVID-19. Several of the goals of our osteopathic self-treatment are to improve the respiratory circulatory system, to enhance the immune system, to balance the nervous system, and to reduce stress. All of the exercises and stretches you'll see here should be performed in a pain-free manner. If there's any pain or discomfort, you should stop. This osteopathic self-treatment is meant to be performed in addition to and not in replacement of all other medical advice of your providers.
First exercise, addressing the first rib or uppermost rib and collarbone at the base of the neck, also called the thoracic inlet. How to perform this exercise. Rib 1 and the collarbone are at the base of the neck on the left and right sides. To make sure these bones move properly, we will use arm and shoulder movements. Person can either be standing or sitting down. Perform arm circles slowly while inhaling as you raise the arm and exhaling as the arms are lowered down. Perform arm circles in both directions, one arm at a time. For example, arms forward and up, or arms backward and up to start the circle. You may repeat 3 to 5 times in one direction and reverse. Then, do the same thing but just with the shoulder blade. Large circles with the shoulder blades in both directions. Next exercise. First thoracic vertebra at the base of the neck. Thoracic inlet. This is to be performed seated. The top vertebra of the thoracic spine, or T1, is at the bottom of the neck. We will use the neck and head movements to make sure this bone moves properly. Do not perform this exercise if moving the neck in certain directions makes you dizzy. With a straight back and shoulders, look to the left as far as possible without tilting the head and without causing pain or dizziness. Repeat the same to the right. Look back to the front. Then look down, bending the head forward as far as it goes without causing pain or dizziness. Look to the front. Then look up, bending the head backwards as far as it goes without pain or dizziness. Look back to the front. Without looking to the left or right, or down or up, tilt the head to the left as far as it goes, and then to the right. Look back to the front. And then combine these motions and moving the neck in a circular fashion, first to one side and then to the other side, making sure there's no pain or dizziness. After you do the circles, sit in the chair to make sure you're not dizzy before standing. Next exercise addresses the muscles between the bottom of the ribs and the pelvis or hips. How to perform. Sit on a chair with feet flat on the ground and the weight of the body distributed evenly on both sitting bones. Without lifting the hips, lean to the right as far as you can. Then lift the left arm to one side and up until you feel a stretch on the lower body from the lower rib cage to the hip. And then start to slump your low back to increase the stretch. Hold for 10 to 20 seconds and then repeat to the other side. Next exercise is the self-correction of the head on the neck area, or occiput to atlas joint. The person is seated. Place both hands on the back of the neck, just under the skull. Fingers may or may not overlap. Move the head on the hands back and forth, side to side, turning to one side and then the other, tilting to one side and then the other. The aim is to free up the head connection to the top of the neck. Move slowly to stretch the tightest areas of the neck. Repeat each direction of motion, turning, tilting the head to one side and the other, bending the head forward and backwards, 3 to 5 times in each direction until even motion is felt. Next exercise, self-correction of the atlas and axis joint, which is at the top of the neck. This area is involved in turning of the head. How to perform. Start by sitting in the chair with your head bent forward as far as it goes without pain. Test the turning or rotation of the neck to the left and then to the right without lifting the head to find out which side turns less than the other. To make the movement symmetric, keep the neck bent forward and turn the head towards the tightest side, the side that does not go as far as the other side. Keep the head turned that way for 3 seconds. Turn the head a little farther in the same direction and wait another 3 seconds. Turn the head a little farther in the same direction and wait another 3 seconds. With the head bent forward, move the head in both directions again to see if the head moves equally on both sides. Front of neck muscle stretch. How to perform. Sit on a chair with your back and neck straight. Grasp the chair with your left hand and gently pull down on your left collarbone with your right hand. Lean your whole body to the right and bend the neck to the right, bringing the ear towards the right shoulder. Keeping that position, turn the head or rotate to the left. Position the head back with the chin up and slowly tuck your chin until a stretch is felt in the front of the neck on the left side. Hold for 10 to 20 seconds and then repeat the above steps on the other side. Upper back stretch Muscle's name is levator scapula. How to perform. With the left hand securely grasping a chair, slowly lean the body toward the right and a little forward until a stretch is felt. Position the head in a forward position with the chin down, leaning to the right and turning the head to the right. To intensify the stretch if needed, gently place the right hand on top of the head and add gentle pressure to the right. Hold for 10 to 20 seconds. Repeat the above steps by reversing the direction of motion to stretch to the left side. Next exercise is the upper shoulder stretch. Muscle name is upper trapezius. How to perform. Sit with your back and neck straight. Grasp the chair with your left hand. Lean to the right. Position the head forward, bend the neck and tuck your chin. Turn the head to the left. With the right hand, slowly and gently encourage further stretch to the right for a gentle stretch. Emphasis on the stretch can be added by nodding or tucking the chin towards the chest. Hold for 10 to 20 seconds. Repeat the above steps by reversing the direction of the motions to stretch the left side of the upper back. Next exercise, head and neck posture training by strengthening the deep muscles in front of the neck. How to perform. Person is sitting. Place your hand on the superficial front neck muscles. These muscles should not tighten during the exercise. While seated, nod the head forward slowly. Tuck the chin toward the chest rather than bending the head forward. Hold for 5 to 10 seconds. Relax. Repeat the above steps 2 more times. Then, throughout the day, concentrate on keeping good head-neck posture. Next exercise, gentle self-massage of the neck and upper shoulder. How to perform. Person is seated with the left arm relaxed. Take the right hand, cross it over the front of the body and reach the upper shoulder muscles. Pull the upper shoulder muscles forward rhythmically from the shoulder to the left side of the neck and back to the shoulder gently but firmly. You can also pinch that muscle for a few seconds between the thumb and the fingers to relax it more. With the right arm still in front of the body, place the fingers of the neck on the left side of the back of the neck and pull forward rhythmically in sections from the base of the neck to the top and then reverse. The head and neck may stay still or move as it is comfortable. The next step is to change the hand positions by moving the right hand to behind the neck on the left side. Place the fingers on the left side of the neck and pull up and back by sections rhythmically from the bottom of the neck to the top and back down. Repeat all these to the other side. Next exercise, underarm and back muscle stretch. Muscle's name is latissimus dorsi. This stretch is also called the prayer position stretch. How to perform. Kneel in front of a chair. Place the elbows on top of the chair with the hands and forearms together. Make sure the elbows stay together the whole time, since this will serve to separate the shoulder blades. Slowly press the chest forward to the floor as you sit back on your heels. Once the shoulders are on stretch, tighten your abdominal muscles and hunch your whole back up to increase your stretch. Hold for 10 to 20 seconds. Note, if you do not feel the stretch on the lower back, it is because the knees may be too far away from the chair. If that's the case, reposition yourself by bringing the knees a little closer to the chair and start all over again. Front of hip muscle stretch. Muscle name, psoas. How to perform. To stretch the right front of the hip muscle, kneel with the right knee on the floor and the left hip bent to 90 degrees and the left knee bent to 90 degrees. Then slide the left foot forward about 6 inches. Rest the left hand on the left thigh or hold on to a chair with the left hand for balance. Position the right leg so that the right foot is turned out and the upper thigh is rotated or facing inward. Pull the stomach and tighten the right buttocks hard. Keep the right hand on the buttocks to feel the contraction. Already you should start to feel a stretch in the front of the right hip and thigh area. For a bigger stretch, add the following. Keep the shoulders positioned over the hips and use the left leg to pull the body and the right hip forward, feeling a stretch in the front of the right hip and thigh. Face down, pressing up. How to perform? Lie down on the floor with your chest and stomach facing down. Using your arms, push the upper body off the floor, keeping the front of the hips on the floor to create a stretch from the chin to the belly. To intensify the stretch, you may tilt your head backwards to look up as long as this does not cause pain in the back or neck or dizziness. Hold for 10 to 20 seconds. Next exercise, spinal stimulation, thoracic and rib areas. How to perform? Lie on your back with your feet on the ground and knees up, arms folded in front of your chest and head off the floor. Lift the buttocks, rounding your back, starting at the hips and moving up the spine until reaching the base of the neck. The back has the shape of the foot of a rocking chair at this time. Keeping the head off the floor and the back bent forward, lower the hips, feeling each segment of the spine contact the floor. Do this movement back and forth in a rocking motion. Emphasis can be placed on the middle of the spine, then on the right side, then on the left side, or vice versa. This needs to be a smooth motion. Repeat 5 to 10 times. Next exercise. This exercise addresses the bottom of the spine. How to perform? Lie on your back. Bring both knees up, keeping the feet on the floor. Twist the bottom of the spine by bringing the knees to the right as far as they go, while keeping the shoulders flat against the floor. Hold for 10 to 20 seconds. Repeat the same motion by bringing the knees to the other side. Next exercise.
A special thank you to Dr. Figueroa, Dr. Lewis, and Ryan McDunn, a fourth-year fellow. If you have any questions, please send them to the school. And here are the links again with the video in the handout. Thank you.
At the Des Moines University Clinic Osteopathic Manual Medicine Department, our physicians treat a full range of health conditions according to our different specialties. We integrate osteopathic manipulative medicine into a wide range of backgrounds and trainings, including family medicine, internal medicine, pediatrics, rehabilitation medicine, and neuromusculoskeletal medicine. Osteopathic manual medicine, or OMM, is a hands-on, non-invasive way to assess and treat the structure of the body to improve the function of all systems in the body. DMU's osteopathic physicians assess the structure of the body for twists and turns in the body's framework that can either contribute to or altogether cause your original disease or illness, even injury. These twists and turns are diagnosed and treated by the physician's own hands. Some examples of conditions we treat include adults with chronic illnesses in breathing, digestion, sinus infections, needing help healing after surgery, nerve damage, diseases of the spine, and migraine headaches. We even treat pregnant patients and babies. OMM allows the body to function more efficiently supporting the ability to fight off disease and more easily recover from illness, injury, or surgery. DMU's clinicians provide thorough consultations to patients to address illness and symptoms that may not be helped by conventional treatment. We invite you to give our clinic a call if you're looking for a physician who can help you get to the root cause of your illness or injury. We're here to help.